You wake up in the morning, put on your slippers, and go make coffee. Then you go to the market wearing those same old sneakers, the ones that have already molded to your feet and seem comfortable. In the afternoon, if there is an occasion, maybe even the high-heeled shoes you have worn your whole life. It seems like a completely normal routine, and it probably is, because no one has ever told you that what you put on your feet may be feeding the knee pain you have been feeling for months. It is not the first thing that comes to mind when your knee hurts. You think about wear and tear, osteoarthritis, age, but the shoe, no one questions that. And that is exactly why it keeps causing damage without you realizing it. Every step you take starts in the foot. The way your foot touches the ground, how it distributes weight, how it absorbs impact, all of this reaches the knee in fractions of a second. The right shoe protects this chain. The wrong one sabotages it, silently, with every step, over months and years. I have been a physical therapist for more than 10 years, and today I am going to show you 3 shoes you probably wear and that are harming your knee, and 2 you should consider wearing instead. Let me explain why shoes matter so much, and why almost no one talks about it. Every step you take starts in the foot. The foot touches the ground, distributes weight, absorbs impact, and in fractions of a second, all of this reaches the knee. Now multiply that by the number of steps you take in a day, in a week, in a year. The shoe you wear during each of those steps is, silently, either protecting or overloading your joint. Science confirms this. Studies show that footwear has significant effects on the body's biomechanics, and that wearing heels can increase knee flexion, anterior pelvic tilt, and trunk extension, creating repetitive overload that leads to pain and the development of osteoarthritis in the joints. And there is something that really impresses me in the clinic. Most people choose shoes based on immediate comfort, that good feeling when they try them on in the store. But immediate comfort and real support are very different things. A soft, lightweight shoe may seem perfect the first time you wear it, and become a serious problem after a few months when the cushioning collapses and leaves the foot without protection. There is also one detail that very few people check: size. Studies with patients in clinical settings show that most people wear the wrong shoe size, often too tight, which changes the way they step and transfers load to the knee asymmetrically. It is not just high heels that are harmful. A slipper with no support, an old sneaker with a worn-out sole. All of them change your step, misalign the knee, and increase the load on the joint in different ways. That is exactly what we are going to break down now. Tell me here in the comments, what shoe do you wear the most in your daily life? It will be interesting to see the answers after this video. Before we begin, in the first pinned comment, you will find 2 tools that can help you on this journey: a complete exercise program to do at home and a natural supplement for joint health. Take a look when you finish the video. Now let us move on to the first shoe you should avoid. Shoe 3. High heels. Let us start with the most obvious one, but it deserves an explanation that goes beyond the obvious. High heels are a lifelong companion for many women. Decades of work, parties, weddings, graduations. Heels have been there through all of it. But what happens to the knee when you put on high heels? The heel rises. The body's weight shifts forward. The knee bends more than it should to compensate for this imbalance. All of this happens with every step automatically without you even realizing it. Studies show that walking in high heels increases the compressive force in the medial compartment of the knee by an average of 23%, the inner part of the joint, which is exactly where osteoarthritis usually starts first. And there is something few people know. Research indicates that prolonged use of high heels may contribute to joint wear and the development of knee osteoarthritis. And the higher the heel, the greater the risk. This does not mean you can never wear heels again. It means that for everyday life, the walk to the market, the afternoon at home, the outing with the grandchildren, heels charge a price your knee does not need to pay. If you still want to wear heels on special occasions, that is fine. But consider limiting the height for daily use. Above that, the knee is working harder than it should with every step you take. Now let us move on to number 2. This one is going to surprise you because it is exactly the shoe people wear thinking they are giving the knee a rest. Shoe 2. Slippers, flip-flops. This is the most commonly used one at home, and the most underestimated when the subject is the knee. Flip-flops have become the shoe of rest. You get home, take off your sneakers, and put on flip-flops. You go to the market in flip-flops. You spend the entire afternoon in flip-flops. It seems harmless. After all, they are light, easy to wear, and do not squeeze anything. But let me show you what happens in the foot when you wear flip-flops. With no secured heel, the foot slides forward with every step. To compensate, the toes involuntarily contract to hold the flip-flop on the foot. A constant tension that changes the entire way you step. With no lateral support, the ankle wobbles slightly inward or outward. And this instability travels straight up to the knee. Now there is a piece of information that will surprise you. And it is important to be honest here. Studies show that flip-flops and flat, flexible shoes create knee loads similar to walking barefoot, significantly lower than rigid shoes with elevated heels. So the problem with flip-flops is not that they are flat. It is the instability, the lack of heel support, and the excessive movement of the foot inside them. And here comes the issue of flat sandals, which many people use as an alternative to flip-flops, thinking they are better. A completely flat sandal with no support has the same problem. What makes the difference is having a secured heel, lateral support, and a stable base. A sandal with a heel strap and arch support is a much better choice than a flip-flop or a loose flat sandal, whether it is flat or not. For everyday use at home, consider replacing flip-flops with a sandal that is closed at the heel, even if it is simple. This small change removes a burden that the knee silently carries for hours. Now let us move on to number 1, and this is the most treacherous one of all because it feels familiar, feels comfortable, and is in almost every closet. Shoe. 1. Old and worn-out shoes. This is the most treacherous one on the list because it does not look like a problem, it looks like an old friend. You know this shoe. It has already molded to your foot. It already knows where your heel lands. It no longer squeezes anywhere. It feels comfortable exactly because it is worn out. And that is why no one replaces it. Why replace something that feels so right? But let me show you what is happening underneath that comfort. With use, the sole of any shoe wears down asymmetrically, usually more on one side than the other, more at the heel than at the front. Have you ever noticed this? Comment down below. And if you have not noticed it, you can look at your old shoe now and observe it. This uneven wear creates a tilted surface that the foot does not consciously notice, but that changes the way you step with every stride. Studies show that worn-out shoes significantly increase the knee adduction moment, the force that pushes the knee inward, in addition to altering hip and ankle movement patterns during walking. In simple language, a worn-out shoe makes you compensate without realizing it. The body adjusts the step to deal with the uneven surface, and this compensation goes straight to the knee week after week, month after month. And there is a detail that the reference videos mention, and that is very real in the clinic. The internal cushioning of the shoe collapses long before the sole shows visible wear. You look at the shoe, see that it is still intact on the outside, and think it still works. But inside, the foam that used to absorb impact no longer exists, and the knee is receiving every step without cushioning. A good practical rule: when you start noticing asymmetrical wear on the sole, when the heel is clearly worn down on one side, or when the internal cushioning no longer has firmness, it is time to replace it. Do not wait for the shoe to ask to be replaced, because when it visibly asks, your knee has already been paying the price for some time. Now let us move to the positive side, the 2 shoes you should consider wearing. Sneakers with arch support. Shoe 2. Now we get to the positive side, and I am going to start with a piece of information that will surprise you, because the science on this subject is more complex than it seems. For years, the standard recommendation was clear: wear shoes with arch support, cushioning, and a stable sole. And that recommendation still makes a lot of sense, but with one important detail that few people mention. A clinical study showed that wearing stable, supportive shoes for 6 months reduced knee pain during walking by an average of 63% more than wearing flat, flexible shoes. That is an impressive number, and it confirms that supportive sneakers make a real difference in the daily life of someone with knee pain. What should you look for in sneakers with arch support? 4 main things. First, the heel needs to be well contained, firm, with no wobble, without letting the foot slide sideways. Second, the sole needs to have real cushioning, not that soft foam that collapses in a few months, but a structure that maintains firmness with use. Third, the sneaker needs to have medial stability, reinforcement on the inner part of the sole that prevents the foot from rolling inward, the famous excessive pronation that overloads the knee. And fourth, the toe box needs to have enough space. A sneaker that is tight in the front changes balance and transfers load asymmetrically. It does not need to be expensive. It needs to have these characteristics. When buying, test it like this. Hold the sneaker by both ends and try to twist it. A good sneaker resists. It does not twist easily. Then bend it in half. It should bend at the toe area, not in the middle of the sole. If it bends in the middle, it lacks structure where it matters most. Now let us move on to number 1, the modern orthopedic shoe. And before you turn up your nose, let me show you how it has changed. Modern orthopedic shoe, shoe 1. Before you imagine that huge, heavy, ugly black shoe we associate with the word orthopedic, stop. The modern orthopedic shoe has nothing to do with that. It has evolved. Today it comes in discreet, lightweight, good-looking models. And also in sandals, for those who do not want or cannot tolerate closed shoes. But what defines a modern orthopedic shoe is not its appearance, it is its function. And that function was built based on decades of research on how the foot moves and how that movement affects the knee. Evidence-based reviews show that shoes with lateral support, soles with proper cushioning, and minimal heel elevation reduce medial knee load and pain in people with osteoarthritis. In other words, the right shoe is not just comfortable. It actively redistributes pressure inside the joint. What differentiates a modern orthopedic shoe from a regular shoe are some very specific details. The toe box is wider. The foot has real space to position itself without compensations. The insole is removable, which allows it to be replaced with a custom insole if necessary. The heel counter is firm and structured. It keeps the foot stable without letting the ankle wobble. And the sole has a slight rocker, that gentle curve that makes the transition from heel to toe easier, reducing the knee's effort with every step. Studies show that patients who wore footwear with proper support experienced up to a 20% reduction in knee pain after 6 months. It is not surgery. It is not medication. It is a shoe. And for those who prefer sandals, the good news is that the orthopedic concept also exists in this format. In the United States, brands like Vionic and Birkenstock are highly recommended by podiatrists. Look for sandals that combine arch support, real cushioning, and modern design in a sandal you would wear in your daily life without thinking twice. But regardless of the brand, when choosing a sandal, specialists recommend that the more straps, the better. And one of them must necessarily go behind the ankle. Without that strap, the toes stay under constant tension to hold the footwear in place. And this tension creates compensations that travel straight up to the knee. I promised 3 practical tips at the beginning of the video. And here they are. Simple, direct, and you can use them the next time you walk into a store. Tip 1. The twist test. Take the shoe by both ends and try to twist it as if you were wringing out a towel. A good shoe resists. It does not twist easily. If it rotates too easily, it lacks structure where it matters most. This test reveals in seconds whether the shoe will give your foot real support or leave it loose with every step. Tip 2. The bend test. Now bend the shoe in half, pressing the toe against the heel. It should bend at the toe area, not in the middle of the sole. If it bends in the middle, it means the sole is flexible where it should be firm. and a flexible sole in the middle means less stability for the ankle and more load for the knee. Tip 3. The space test. Put the shoe on your foot and check the space in front of your longest toe. There should be about 1 finger of room between your toe and the tip of the shoe. It may seem small, but this is the space that ensures your foot will not compensate in your step because of lack of room. And check the width too. If your foot spills over to the sides inside the shoe, it is too narrow and will change the alignment of the knee. 3 tests, less than 2 minutes, and you already have enough information to make a much better decision when buying. The shoe is one piece of the puzzle. It is not the complete solution. If you change your shoes and still feel intense pain, if your knee swells, locks, or progressively gets worse, do not wait. See a doctor to understand the cause and a physical therapist to work on rehabilitation. The right shoe helps. But every body is unique, and there are situations that need an individualized professional assessment. Now tell me here in the comments, which of the 3 shoes to avoid do you use in your daily life? And are you going to rethink after this video? I am curious to know. If this video made you look differently at what you put on your feet every day, share it with someone who also needs to hear this, and subscribe to the channel to continue this conversation. And since we talked so much about what shoes do to the knee, how about taking care of the knee from the inside too? Here on the channel, I have a complete video with 5 chair exercises, especially for those who have knee pain after 60. It will appear on the screen now. Watch it after this one. Until the next video.